Hello, my name is Bakri Vasant, and I'm a public health physician at the Metro South Public Health Unit. Thanks very much for watching this presentation on preparing for seasonal influenza at residential care facilities. For this presentation, I'd like to acknowledge Christine Moore, one of the public health nurses at the Metro South Public Health Unit. This presentation has three key take-home messages. Firstly, flu vaccinations for residents and staff are important in preventing the spread of flu. Good hand hygiene, cleaning of surfaces, and other infection control measures are required to prevent the spread of flu. And finally, if residents become sick with the flu, this needs to be recognized early and steps need to be taken to prevent further spread. Firstly, what is the flu? The flu is caused by the influenza virus or germ. It can be a serious disease. People who have the flu might have fever, cough, shortness of breath, and body aches. The flu is contagious and can spread from one person to the next by coughing, sneezing, talking, or touching a surface with the flu germ and then touching your nose or mouth. The flu can be a serious disease, and because it is caused by a virus, this type of germ cannot be treated by antibiotics. Serious problems with the flu can occur at any age. Complications of the flu include pneumonia, sinus or ear infections, dehydration, and worsening of existing medical conditions such as diabetes or heart disease. Elderly residents at residential care facilities are at high risk of severe infection, hospitalization, and death. They have a higher chance of getting very unwell compared with the rest of the community. To prevent flu outbreaks, it's important to know what a flu outbreak is. A flu outbreak is if there are 3 or more people with a flu-like illness in residents or staff at a residential care facility. Flu outbreaks can be prevented by vaccinating residents and staff, good hand hygiene, cleaning of surfaces, and other infection control measures. It's also important that the flu or flu-like illness in residents is recognized and steps are taken to prevent the spread. National guidelines recommend that staff and residents have a flu vaccine every year. The flu vaccine is also recommended for visitors and volunteers. There are a number of benefits of getting the flu vaccine. It reduces your chances of catching the flu. It reduces the severity of the flu, so you might not get as sick if you have the flu vaccine. It is the most effective way of reducing your chances of getting admitted to hospital and also reducing the chances of disability and death caused by the flu. And importantly, vaccinating staff can help protect residents. The flu vaccine is recommended every year because the types of flu in the community change from year to year. Each year, the flu vaccine can cover different types of flu. The flu vaccine is safe to use for adults and it is also recommended and funded in every pregnancy. So we would encourage all pregnant staff at aged care facilities to have the flu vaccine. I'll now cover a few questions about the flu vaccine. Firstly, can the flu vaccine give you the flu? And the answer to that is no. The flu vaccine in Australia does not have live flu germs and cannot give you the flu. The next question is, I had the flu vaccine last year. Why did I still get the flu? The answer to that is it is possible that you did not actually get the flu. You might have had another type of infection, for example, a cold. Or the flu vaccine causes protective antibodies to develop about 2 weeks after the vaccine is given. You might have caught the flu before your body had a chance to develop these antibodies. You may have caught a different type of flu to the type covered by the vaccine. And finally, like all vaccines, the flu vaccine prevents disease, but is not 100% effective. The next question is, should I get the flu vaccine every year? And the answer to that is yes. Each year, the types of flu in the community changes. As a result, the types of flu the vaccine may protect against may change from year to year. The last question is, I am young, fit, and healthy. Is it better to get the flu than the flu vaccine? And the answer to that is no. Flu can be a serious disease and can cause disability and death in any age group. If you work with elderly in residential care facilities, it is important to remember that elderly people have a high chance of getting severe disease. Another way of preventing the spread of flu and other germs is good hand hygiene. Remember to wash your hands or use alcohol-based hand gel before patient contact, before any aseptic task where you don't want to introduce germs, after any body fluid exposure risk, so remove your gloves after this and wash your hands, after patient contact, and after contact with the patient's surroundings. It is also important that visitors to aged care facilities have good hand hygiene practices, particularly if there is an outbreak of the flu. In this situation, it's important that visitors use alcohol-based hand gel or wash their hands before entering and leaving the facility, and they also check at nursing stations before their visit. It is important that visitors do not visit if they are sick, and particularly during an outbreak, they visit only one resident at a time. The flu vaccine is also recommended for all visitors. Recognizing a flu outbreak early is important. So this will involve identifying residents with symptoms of the flu early. Residents should be seen by their doctor as soon as possible. Laboratory testing for the flu is also important, and infection control helps to reduce the spread of the flu. Infection control includes good hand washing, cleaning of surfaces, having sick residents stay in their own room, and staff using appropriate personal protective equipment, such as masks, gowns, and gloves. And finally, staff or visitors with the flu or other respiratory infections should not be at the aged care facilities when they are sick. In conclusion, let's revisit those key take-home messages. Vaccinations for residents and staff are important in preventing the spread of flu. Good hand hygiene, cleaning of surfaces, and other infection control measures are required to prevent the spread of flu. If residents become sick with the flu, this needs to be recognized early and steps need to be taken to prevent further spread. Thanks very much for watching this presentation on preparing for seasonal influenza at residential care facilities.